Welcome to the CMS EHR Incentive Program Attestation Tutorial for Eligible Professionals. This tutorial is only for eligible professionals who are attesting to the Medicare program. To attest to the Medicaid program, visit your state Medicaid agency's website to learn more. To successfully attest, you will need to have already determined your eligibility to participate in the Medicare program, successfully registered for the Medicare program on the CMS EHR Incentive Program Registration System. You will need to have met the required number of core, menu, and clinical quality measures. And please note, if you have not yet done this, review the Meaningful Use spec sheets on the CMS website. Recorded meeting your meaningful use criteria for the appropriate period of time. And finally, for those attesting for the first time, you will report meeting your criteria for 90 days' time. After your first year, you will report for the full year, 365 days and 366 during a leap year. You can also check on whether you have met meaningful use requirements before beginning the attestation process by using the Eligible Professional Meaningful Use Calculator. This tool will allow you to enter your specific meaningful use data and see if you have met the necessary requirements to successfully complete attestation. The About This Site page provides you with information about the program and about those who are eligible to participate. Selecting the Eligible Professional link expands the section to display additional information about which professionals are eligible to participate. Selecting the link again collapses the additional information. Select the Continue button to proceed. The Login page instructs you on what is required for a valid user ID and password combination. As an eligible professional, you are required to have an active NPI and must have a National Plan and Provider Enumeration System, or NPPES, user account to log in. As a result of HIPAA, the National Plan and Provider Enumeration System collects identifying information on healthcare providers and assigns each a unique NPI. If you do not have an NPI, click on the NPPES hyperlink provided. A link to the Identity and Access Management System is also provided. The Identity and Access System allows you to reset passwords and edit your account information. Any additional login issues can be resolved by contacting the information desk and the number provided. At the bottom of the page, you may enter your user ID and password combination. Please keep in mind that both of the fields are case sensitive. Once you have logged into the system, the links and tabs displayed in the top right-hand corner are shown on every page. The Home hyperlink navigates you to the Welcome page that is currently shown. The Help hyperlink opens a PDF user manual that assists you throughout the registration and attestation process. If at any time you wish to log out of the system, click the Logout link and select Yes in the pop-up window. The Instructions section on the Welcome page describes the actions that can be performed under each of the tabs. You can submit and maintain your registration under the Registration tab and complete your attestation under the Attestation tab. The Status tab provides a snapshot of your current standing in the EHR Incentive Program. This includes the status of your registration and any attestations and payments associated with your account. The Account Management tab allows you to proceed to the Identity and Access System in order to change your account information. Clicking the Registration tab will reveal a set of instructions about the actions that can be performed. These options will differ depending on the status of the registration. Again, your registration must have an active status in order to move forward with your attestation. Clicking the Attestation tab will reveal a set of instructions about the actions that can be performed. These options will differ depending on the status of the attestation. Under the Attestation Selection section, action items can be selected for each available attestation. Listed in this section are your name, tax identifier, NPI, Medicare attestation status, program year, payment year, and action. If no previous attestation has been completed, the action column should read Attest. If an attestation has started but not submitted, the Modify or Cancel options should be visible. If you have recently successfully submitted your attestation, the Not Available would be displayed. If you have canceled your attestation, the Reactivate option will be available. If your attestation was rejected, the Resubmit and View options will be available. If you choose to cancel an attestation that is in progress, you will be brought to the Cancel Attestation page, where detailed attestation information is provided. You must provide a reason for canceling your attestation in the Reason for Cancellation box before you can finish your cancellation. Records with an attestation status of Payment Issued, Locked for Payment, or Accepted will display the View action. Records which do not have an active registration will have Not Available displayed in the action column. For this demonstration, we'll begin as an eligible professional that has not yet begun the attestation process. Click the Attest button next to the eligible professional program year you wish to attest for. You will be directed to the topics for this attestation page. Here you are shown the topics you must complete to finish your attestation. The system will place a check in the completed column when a topic has been successfully completed. As an eligible professional, you must meet a total of 15 Meaningful Use core measures and 5 out of 10 Meaningful Use menu measures in order to receive an incentive payment. You must also report on 3 clinical quality measures and 3 additional clinical quality measures. If you enter a value of 0 in any of your clinical quality measures, you must provide corresponding measures in the alternate clinical quality measure. Visit the Meaningful Use page on the CMS EHR Incentive Program's website for more information. When all topics have been marked as completed, the Proceed with Attestation button can be selected to complete the attestation process. Select the Start Attestation button to begin the first topic. The attestation information page is shown. Fill in your EHR certification number and EHR reporting period, start and end dates here. Click the How do I find my EHR certification number for guidance. The reporting period for the first payment year must be at least 90 days. The reporting period for the second year must be 365 days. For 2012, which is a leap year, you must report 366 days. The reporting period must be within the EHR calendar year, January 1 through December 31. The reporting period end date must be before the date you are submitting your attestation. A reporting period can only be used for one payment. You cannot use one reporting period for 2 years. Select the Save and Continue button to save this information and navigate to the Meaningful Use Core Measures page. The Meaningful Use Core Measures section of the module provides a questionnaire for each of the 15 required core measures. Each question must be completed for this section. The first question focuses on the use of Computerized Physician Order Entry, or CPOE as it is also known. The objective measures that more than 30% of all unique patients have at least one medication that has been ordered through CPOE. You must select whether the data used to support this measure comes from all patient records or just those maintained using certified EHR technology. Please note that patient record questions will be asked in other Meaningful Use Core and menu measure questions. You must also fill in whether or not the exclusion pertains to you. If you are not eligible for the exclusion and select the circle marked No, a new section with 2 entry boxes will appear and the correct numerical entry for both the numerator and denominator sections must be filled in. All numerators and denominators must be whole numbers. For the Meaningful Use Core and menu measures, the numerator must be entered first. Click on the Save and Continue button to go to the next question. Clicking the Save and Continue button will allow you to log out of the system at any time and continue your attestation later. All of the information that you have entered up to this point will be saved within the attestation module. You should continue to answer the remaining 14 questions on Meaningful Use Core measures. You must complete each question including all sections marked with an asterisk to continue. If you have any questions about any of the criteria, refer to the Meaningful Use spec sheets on the CMS EHR Incentive Program's website. For questionnaire 10 of the core measures shown here, you must report if you will submit clinical quality measures to CMS in the manner required by CMS. You will not receive your payment unless you report on your clinical quality measures. Select the Save and Continue button once you've completed all 15 measures and are satisfied with all of your answers. The Meaningful Use Menu Measures page provides a comprehensive list of all of the active menu measures and allows you to select the 5 measures you have chosen to meet. The first section contains the 2 measures from the public health list. The second section contains 8 additional Meaningful Use menu measures. At least one of these measures must be from the public health menu measures, even if an exclusion is applicable. After selecting one public health menu measure, you must select any other 4 Meaningful Use menu measures. You may select any combination from the remaining public health menu measures or from the additional Meaningful Use menu measures, even if an exclusion applies. Read the bold text to better understand the exclusions. In the next section, you will be asked to answer each question that you have chosen from this list. After a total of 5 measures have been selected, click on the Continue button. You will now enter your criteria in each measure that you have selected to meet. You will notice that the questionnaire is similar to the Core Measures questionnaire. Responses are required for each measure that you have selected to meet. If you qualify for an exclusion for a specific measure, then you would select Yes, this exclusion applies to you. If an exclusion does not apply, then No should be selected. After the question has been completed, click on the Save and Continue button to go to the next question. For each of the remaining menu measure questions, please check the appropriate boxes and fill out the correct information, clicking on the Save and Continue button after each question has been completed. After all 5 of the menu measures from the questionnaire have been answered, click the Save and Continue button. The next set of questionnaires discusses the core clinical quality measures. You should be sure to enter whole numbers as both the numerator and denominator in the boxes shown. All 3 core clinical quality measures must be submitted to properly attest and receive a payment. The denominator is entered first for the clinical quality measures. For each core clinical quality measure that has a denominator of 0, an alternate core clinical quality measure must also be submitted. If you do not select an alternate core clinical quality measure, you will receive an error message prompting you to select an alternate core clinical quality measure. These measures help CMS evaluate healthcare processes, outcomes, patient perceptions, and organizational structures and systems that are associated with the ability to provide high-quality health care and that relate to one or more quality goals for health care. CMS wants to know if the EHRs are leading to effective, safe, efficient, and timely care. After you have completed a question, click on the Save and Continue button to continue to the next clinical quality measure question. After completing all of your core clinical quality measures and any necessary alternate core measures, click Save. You will now need to select 3 additional clinical quality measures. Depending on which 3 measures you select, you will be prompted to enter numerators, denominators, and exclusions. You must complete each selected question, including all sections marked with an asterisk, to continue. Once you have completed all selected additional clinical quality measures, the system will bring you back to the topics for this attestation page. A check in the completed column will indicate that a topic has been completed. Verify all of your topics have been completed and select the Proceed with Attestation button to navigate to the Summary of Measures page. Here you can review and change the core, menu, and clinical quality measures one last time before you submit your attestation. Click on the corresponding link to review the measures. The Summary of Measures page provides the details for each measure of your attestation. Here you can review and change the information you have entered one last time before you attest. To review one of your measures, click on the desired measure link. In this demonstration, we will walk you through all 3 of the measure reviews. To review your core measure responses, click on the Meaningful Use Core Measures List table link. The Meaningful Use Core Measures List table page provides a comprehensive list of each core measure and objective, with the answer you provided under the Entered column. Clicking on the Continue to Attest button will allow you to skip viewing the summary of measures and proceed with your attestation. To edit a response, simply click the Edit button next to the measure you would like to edit. For our demonstration purposes, let's go ahead and click on the Edit button. Clicking the Edit button brings you to the specific core measure question that you have selected. You can change your response to this question if you would like. To discard your changes and return back to the Summary of Measures page, click the Return to Summary page button. To save the changes you have made and return to the Summary of Measures page, click on the Save and Continue button. Now that you have made sure your answer is sufficient, click the Return to Summary page button. Click on the Next Page button to continue on to the summary of Meaningful Use Menu Measures List table. The Meaningful Use Menu Measures List table page provides a comprehensive list of the 5 menu measures you previously selected and their objectives. The answer you provided is located under the Entered column. Review and make changes as needed, and then click the Save and Continue button. Click on the Next Page button to view the summary of Clinical Quality Measures List table. The Clinical Quality Measures List table page contains the 3 clinical quality measures and up to 3 alternate clinical quality measures and 3 additional clinical quality measures. To edit a response, click the Edit button located in the column situated furthest to the right. Click the Continue to Attest button to leave the Summary of Measures section and proceed with the attestation process. Before submitting an attestation, you must agree to several statements. On the Submission Process Attestation Statements page, a box must be checked next to the 5 statements about the authenticity and accuracy of your attestation. If you do not feel you are able to answer yes to any of the 5 statements, you should select the Disagree button, which will bring you back to the home page. The attestation will not be submitted at this time. Click on the Agree button to proceed with the attestation submission process. The Agree button can only be selected after all 5 statements have been checked. The submission process is almost complete. On the Confirmation page, you should review the summary information to ensure it is correct. You should also ensure that the reason for attestation that has been provided is correct. Reasons for attestation include: you are a Medicare eligible professional completing an attestation for the EHR incentive program. You are modifying your attestation information. You have decided to reactivate your canceled attestation. Or you have decided to resubmit your rejected attestation. If you decide not to submit your attestation at this time, click on the No button. The attestation will not be submitted. However, your information will be saved and the attestation will display on the Medicare attestation page as in progress. After ensuring the confirmation page information is correct, click on the Yes button to navigate to the next page. The attestation disclaimer is provided to ensure that you are truthful and honest with the information you have provided. Every individual should carefully read the disclaimer before clicking on the Agree or Disagree button. Clicking the Disagree button will navigate you back to the Attestation Instructions page, and your status under the Action column will read Modify or Cancel. If you are ready to do so, click on the Agree button to navigate to the next page. You are now at the Submission Receipt page. Your attestation will either be marked as accepted or rejected. If your attestation is rejected, one or more of the necessary objectives was not met. If your attestation is accepted, then all of the objectives and measures have been met. If your attestation has been rejected, there are resources available to help you meet meaningful use objectives and attest again. Contact your local Regional Extension Center for guidance. The Regional Extension Centers are available to help healthcare professionals and hospitals with training, support, and guidance to help them meet meaningful use guidelines. The attestation tracking information provides your information from the confirmation page along with the submission date of the provider's attestation. There are 3 choices for you at the bottom of the page. Because a confirmation of attestation is not sent upon successful attestation, it is recommended that you select the Print button to keep a copy of the submission receipt page for your records. To go to the Home page, select the Home button. To view a summary of all submitted attestation measures, click the Summary of Measures button. The Summary of Measures page provides links to the summaries of the 3 submitted measures from the attestation process. Clicking the Home button will take you back to the Home page. Click the Summary of Meaningful Use Core Measures link to view a detailed summary of your Meaningful Use Core Measures. The Summary of Meaningful Use Core Measures table provides the core measures with their detailed objectives and measures. Your entered information is located under the Entered column. Whether the specific measure was accepted or rejected is also listed, along with a reason for why each measure was either accepted or rejected. Click the Next Page button to view the Summary of Meaningful Use Menu Measures page. The Summary of Meaningful Use Menu Measures page also provides a list of detailed objectives and measures. Columns displayed include your entered data, whether it is accepted or rejected, and reasons for acceptance or rejection. Click the Next Page button to view the Summary of Clinical Quality Measures page. On the Summary of Clinical Quality Measures page, 3 clinical quality measures and up to 3 alternate clinical quality measures and 3 additional clinical quality measures are listed along with the description and status. If your attestation has been rejected, you can resubmit your attestation at the main attestation page. Simply locate the specific attestation you wish to resubmit and click on the Resubmit button under the Action column. This will then take you to Topics for this attestation page, where you can select any topic and make changes to the measure values entered. You can then proceed to attest in the same manner as described earlier. If your attestation has been accepted, you have completed the attestation process. Click the Home button to go to the Home page. This concludes the CMS EHR Incentive Program Attestation Demonstration for Eligible Professionals. Thank you.